Having undergone specialist training in Moorfields Eye Hospital in United Kingdom, I had returned to my hometown of Ipoh in 1974 with the aim of providing affordable, quality eye care services to my patients. LEC Eye Clinic was founded at that time, and from being a solo eye care practitioner in this clinic, LEC Eye Centre was subsequently born in 1999 with the inclusion of 2 other consultant eye surgeons. Since then, we have grown to become a Ministry of Health recognized day surgical centre, and to date, LEC Eye Centre is the largest private group practice in Perak with 4 consultant eye surgeons.
LEC Eye Centre is a one-stop comprehensive eye specialist centre, and we're able to cater to all the eye care needs of our patients. We pride ourselves in having the most advanced technology to provide the best outcomes for all our patients. We have premium cataract surgical services, and this involves the acquisition of the first lens-star optical biometer in Perak, which is actually a laser machine used to measure the eye before cataract surgery. We also have another advanced machine called the Varion Image Guided System, which is actually a precision machine that provides digital marking during cataract surgery. Now, aside from this, we also provide retinal services, and this includes the management of retinal detachment, age-related macular degeneration, and diabetic eye disease. We acquired the first in Malaysia sweat source OCT angiogram, and this actually allows us to take high-definition images of the retina and better manage these diseases. We also want to make sure that we are always accessible to all our patients, and they can make appointments to see us with a click of a button via our online appointment system.
At LEC Eye Centre, we have our in-house optometrists who are vision care experts responsible for accurate testing of spectacle power as well as contact lens fitting. They also provide vital support to our LASIK services. At LEC Eye Centre, we acquired the first in Asia wave-like refractive suite in 2011. One of the fastest lasers in the market, this unique all-in-one suite connects the machines used to measure the eyes before surgery with the laser machines, so all treatment information is sent wirelessly and allows surgery to proceed seamlessly and with unparalleled precision.
At LEC Eye Centre, we recognize the increasing problems of nearsightedness or myopia amongst children nowadays, and we have in place a myopia control program to combat this. This program involves the use of myopin and eye drop, which has been found to be effective in slowing down the progression of myopia in children. So this program aims to increase awareness about myopia and allows our team of doctors, optometrists and nurses to work closely with parents to manage this epidemic which is sweeping the world. A key component of this program is the use of appropriately prescribed eyeglasses, for which our subsidiary company, Eye Care Optical, will be able to provide. Aside from children eyewear, a wide range of adult eyewear is also available.
It is painless, basically because it's bladeless, really fast. I'm really excited with my new eyesight.
The wave-like refractive suite is actually a combination of 5 different elements which forms an integrated platform for laser refractive surgery, or LASIK as we know it. The machines, the lasers as well as the the assessment diagnostic machines are all linked up by a network. All the information that is captured is transferred direct to the laser. So there's no need to enter it several times, and the risk of error is actually more or less eliminated. So it composes of the oculizer, topolizer and the analyzer, which are the diagnostic equipment used to assess patients and to check if the eyes are suitable for refractive surgery. And then the information is then transferred seamlessly to the FS200 femtosecond laser and the EX500 eczema laser for treatment. LEC Eye Centre managed to procure the first unit in Asia.
The technology wave light, definitely one of the best. I did my own research as well online, and yes, definitely it's really good.
This is essentially a bladeless technology, which is a femtosecond, and it's a laser in the infrared range which actually produces very accurate cuts and creates the flap for LASIK. It is currently the fastest in the market, so we can create a flap in under 10 seconds. And then we have the EX500, which is the eczema laser, and it also is the fastest in the market now. One diopter in 1.4 seconds. Together, they can provide very accurate, very consistent treatment.
Before LASIK, I used to have short-sightedness and also astigmatism. Both are quite high, and I've been wearing glasses since I was 7, so it wasn't pleasant at all. I found out about LASIK through my friends, because most of my friends who were wearing glasses, they went for LASIK, and they also recommended me to go for it.
The whole surgery itself, actually, if you want to talk about the actual time it takes to laser, it could happen in less than 30 seconds, depending on cause on the refractive error. But if you talk about actual time taken and the patient spent, I would say approximately 10 minutes per eye. So you would expect the patient to have a drop of anesthetic. The patient is wide awake during surgery, it doesn't hurt at all. We need a drop of local anesthetic so the patient is more comfortable. And then the only part that they will feel anything is when we place a little cup onto the eye, where it creates a little bit of a suction for the femtosecond laser to cut the flap. And subsequently, we have a swivel bed that actually transfers the patient from one laser to the other, so there's no need to get up and walk. And that moves from the femtosecond to the EX500 eczema laser, and the second part of the treatment is done.
Everything was taken care of very, very well by the nurses and the doctor.
Well, the recovery period is very fast, so I would expect patients to be able to see well enough to drive and go back to work the next day after surgery.
On the day of the surgery, I went home and, well, maybe I shouldn't have done that, but I started watching TV. But of course it wasn't that clear, because I could read. For the first time in 20 over years, I could read up close, really, really small writing, and I found that really exhilarating because I've never been able to do that for so many years. I was quite happy and very overwhelming.
The big benefit to the patient itself would be the actual speed of treatment. So the faster the treatment is, in this case the platform has the fastest femtosecond and the eczema laser. It allows more accurate treatment. Why? Because as we know, during treatment the patient is awake. So if there's any sudden movements, then that would affect treatment. So the faster it can be done, the better it will be for the patient.
I would definitely recommend the wave light technology at the Eye Centre to other people, my friends and my family, because it is really safe, and I would say that it's very reasonable for the price, because it actually depends on your eyes as well, how severe your short-sightedness or your astigmatism or whatever it is. And I would say that it's worth it. But I'm really excited with my new eyesight and without having to wear glasses. So much more convenient. You get to enjoy life more.
Hello. Good evening, everyone. Hi, White Tay. Nice to have you again. We also have Chia Yi in the house.
Hi.
Hi. I want to just maybe can have some of you who didn't state your name as a user. I have a phone number here. I have an iPhone here, so we do not know how to identify you. So maybe if you do not know how to rename your name, so you can actually put in the chat, and then we will help you to rename you so we can identify. So later on when you have any Q&A session, we know how to address you properly. Okay, so I hope everyone had a good dinner. So without further much ado, I would like to share screen. Okay, before I share screen, yeah, just want to share with you all, like we will have a Q&A session in between. So if you have any questions, you can actually put your question into the chats. All right, and then we will come back to you on your questions. And then this will be a more direct interactions with our doctor. So today the guest speaker will be Dr. Lim. So later on, if you have any questions, you can actually turn on your video and then you can ask the question directly. If you're too shy to ask, you can actually put into the chats and then we will help you to ask on behalf, okay? So on the other hand, we will, during the presentation, we will actually mute all your mics, so we will have less interruptions. But during Q&A, you can actually unmute yourself to ask your questions, okay? So let me share screen. So I will have a brief introduction of Dr. Lim Meng Hock. He's one of our senior consultant eye surgeon in LEC Eye Centre. He also had his master in ophthalmology in University of Malaya Hospital in 2003. And in 2004, he's the head of department in the ophthalmology department in Hospital Teluk Intan. He's also a very highly experienced and competent surgeon for procedures like cataract with wavefront, toric or multifocal intraocular lenses. He also performed LASIK procedures, pterygium with conjunctival graft using this fibrin glue. This trabeculotomy surgeries is more for glaucoma management, and then also perform like screen eye surgeries and eyelid procedures. Currently, Dr. Lim, beside practicing in LEC Eye Centre, is also a visiting consultant at Perak Community Specialist Hospital. All right. So everyone, let's welcome Dr. Lim. Okay, I will stop my share screen. Let's give him a warm virtual welcome, Dr. Lim. I pass on to you.
Hi, good evening, everybody. Thank you for taking the time to be with us today. I would just like to share to you today's topic, digital eye strain and myopia, and later I will also touch a bit on LASIK. Okay, so to start my presentation, okay, first I just want to say a few things to you all about who we are. So we are actually fully accredited by the Ministry of Health in Malaysia. We are a daycare surgery center with comprehensive specialist eye care services. And this shows to you the facilities that we have. And this is actually our outpatient clinic. It's a few photos of our outpatient clinic, as well as the investigation suite, where we perform investigations to help in the diagnosis as well as the management of the eye cases. And this shows our daycare ward, where we admit patients prior to having surgery done. Okay, we have a VIP room, a day ward, and this is our nursing stations where the patients are monitored by the nurses. Okay, and this is the actual operating suite itself. So here we see one of our doctors performing surgery with the rest of the operation theater staff assisting. And part of our services are premium cataract surgery, which we offer. And here we have all the instruments and machines that help us to perform this surgery. We have the lens card, with the Lensa cataract planner. So this is actually it's a very accurate machine for calculation of the lens implant. Okay, and it's customized for all the advanced technology lens implants. And here, if you have the Varion, the image guided system, okay, this again is to help us in doing the surgery, especially it will increase our surgical precision and optimize the visual outcomes. Okay, and then the Centurion machine. Centurion machine is it has active fluidics, and this is actually our main machine that we use to perform surgery. And it has the most advanced technology, so to ensure that we have very optimal outcomes for the patient. Okay, retinal service. As you know, Dr. Lee Wan Wai is actually a vitreoretinal surgeon, and here we also offer retinal services. Retinal services, this includes treatment of blinding diseases such as retinal detachment, diabetic eye disease, age-related macular degeneration, macular hole, eye stroke, even dislocated cataract. Sometimes a cataract can actually get dislocated and fall into the back part of the eye, and will require vitreoretinal surgery to move it. Okay, so this is a constellation vision system which helps us perform the retinal surgery, vitreoretinal surgery. It is a very advanced machine with ultra high speed, improved safety, as well as improved efficiency. Okay. And this is a wave-light refractive suite. Wave-light refractive suite is actually our suite of machines for performing laser vision correction, namely bladeless LASIK, as well as some cases of advanced surface ablation. Okay, this one later I will elaborate a bit more during my presentation. So briefly, this is actually a fully integrated platform. So all the machines in this system, they are actually linked together so that information from one is transmitted to the next without the need for re-entering of the data by the staff. So this is actually advanced technology for improved speed, safety, and precision. And this wavelight refractive suite is actually the fastest femtosecond and excimer lasers today. Okay, and this is actually advanced imaging technology, which basically helps us or aids us in our diagnosis as well as management of eye cases. So this is our what you call your OCT machine. This is actually imaging for the retina mainly, as well as certain other parts of the eye. Okay, so this one is very advanced, but very high, ultra high resolution scanning, produces 3D, three-dimensional images. Okay, and it's an extremely fast scanning speed. Okay, and it can also perform digital angiography, which means that it can help us to look at the condition of the blood vessels in the nerve of the eye. Okay, we also have optometric services. Optometrists, they are actually another branch of a specialist for vision care, and they specialize mainly in refractive errors of the eye. Refractive errors meaning things like myopia, or what is commonly called short-sightedness, hyperopia, which is far-sightedness, astigmatism, and also presbyopia. Presbyopia is usually seen in people like above 40 years, where they start to have a bit of problem seeing, reading basically, or looking at near objects. So optometrists also provide contact lens services and as well as glasses prescription, of course. Okay, optical services, just 2 shops away from our eye center, we actually have our own eye care optical shop as well, where we can prescribe glasses, contact lenses, as well as we also have a whole array of fashion eyewear and sunglasses. Okay, coming to the presentation itself. So the first part of the presentation, I would like to talk about what we call digital eye strain, or what is commonly called as computer vision syndrome. So as you all know, in today's world, many people, they spend a lot of time in front of the screen, be it computer, laptop, or desktop, or even their handheld devices like handphones or tablets. And especially over the past few months, especially during the period of lockdown where many of us had to work from home, I'm sure time we spend a lot of time in front of the screen, even more time than usual. Okay, so during this time, actually, we did see a lot of patients with a complaint suggestive of what is described here as computer vision syndrome. Okay, so what is this computer vision syndrome or digital eye strain? Actually, this is actually a combination of a few symptoms. So the symptoms actually is basically it's caused by prolonged hours of computer use or use of other digital devices, as I just mentioned just now. So the symptoms include tiredness of the eyes. Generally, patients say their eyes feel very tired. And then you can have dry, burning eyes. Eyes feel very dry and burning. And then difficulty focusing after some time. After you've been looking at the screen for some time, then the words may appear to be double, or you may see like shadowing. You may see like a bit of double outline around the images or the words. Okay, and then another symptom commonly complained by patients is that they have temporary blurring of distance vision when they look up from the computer. After they've been looking at the computer for some time, when they suddenly look up at some distant object, they may feel that even their distant vision is blurred and may take some time to like adjust that or to focus again. And many of these patients, they also have complaints of headaches, or they feel neck or shoulder aches, tension around the neck area. So all these symptoms, they actually part of what we call computer vision syndrome. Okay, so what is the cause of this digital eye strain? Okay, looking at this symptom of tiredness of the eye focusing muscle. Okay, mainly the cause of the eye tiredness is actually accommodative fatigue or tiredness of the eyes focusing muscle. Okay, this sounds a bit technical. I'll try to explain it. Basically, when we look at something which is close, near, or close up, we need to use more effort from a muscle in the eye. This muscle is called the ciliary muscle or the accommodative muscle, and the function of this muscle is to allow our eyes to focus on near objects, especially when you're looking at near things like the computer screen or even the handphone. So obviously, when you spend long hours looking at something in front of you, very close to you, you actually need to use a lot of effort from your accommodative muscle. So over time, this causes tiredness of the eyes, a general feeling of tiredness. And also the words and the images on the computer screen, they are a bit not like the natural images that we see when we look at real things. Computer words and images on the computer, they're actually made up of many pixels, as we know, pixels. That means they're little points of light which collectively will form the word or the image. So these computer words or images, actually they are brightest at the center, and the brightness decreases towards the side of the image. So this actually makes our eyes difficult to actually maintain focus on them. We may not realize it consciously, but it's actually happening on a subconscious level. So when our eyes encounter a situation like this, where the word or the image of the computer is difficult to focus on, the focus of our eyes will tend to drift. It will drift and it will stay at a reduced level of focusing. And this is called the resting point of accommodation. And this on average is about, studies show that it's about average 31 inches away from our eyes. So most of our computer work is actually done at a distance closer than this. So if you want to look at the image closer than 31 inches here, we need to increase our accommodative muscle effort. That means we need to make our accommodation muscle work harder. Okay, so this actually contributes to what I mentioned here about eye tiredness. Okay, and also the other thing is when we look at here, not only our eyes need to have more effort to focus on the words, but automatically when you look at near objects or words, both our eyes need to actually like come closer to each other, what they call converge. Okay, and this also uses other muscles of the eye, muscles which let our eyes come together. So this again will increase muscle fatigue. And also an important point is that, as I mentioned earlier on, presbyopia. People above 40 years old, they may already start to have presbyopia, or in Chinese they call lofa. Okay, so this presbyopia basically means that after 40 years of age, the eye muscles for focusing on at near, especially the words, it may be a bit weak already. So if you were to spend a lot of time looking at the computer, which is a near thing actually, and you don't wear the proper near glasses, then of course your accommodative muscles will need to work very hard. So this of course will increase eye tightness. So an important point here is that if you are already at the age where you have some problem looking at near objects, then or words, then I suggest that if you want to spend a long time in front of the screen, then I think you have to get proper near glasses to help you with your near with the near vision. Okay, another symptom of the computer vision syndrome is actually dry eye. So when you spend a lot of time in front of computers, actually your eyes become more dry. So what's the reason for this? It's actually quite straightforward. When you're concentrating while reading or working on the computer, automatically your eyes will blink less. Okay, this is something subconscious automatically because we are engrossed in concentrating on our work. Our eyes tend to blink less often. So if your eyes remain open for a longer period of time, of course, the tears will evaporate faster evaporation of our tears. Normally, when we're not doing anything specific, when we are like maybe talking casually, our eyes may blink like just every few seconds, you know. But when you're concentrating on something like a computer or doing your work, in 1 minute you may just blink maybe 3 or 4 times, maybe like every 15 to 20 seconds only you'll blink. So this will cause your tears to evaporate faster because the eyes are exposed, open for a longer period of time. Also, when you look at the computer, your eyes tend to be looking more or less straight ahead. Instead of like when you're reading your book, your eyes tend to be like looking down more, and so ultimately the eyes are actually they are a bit smaller. You know? But when you look straight ahead at the computer, your eyes are wide open. So again, the surface area is bigger and your tears actually evaporate faster. So again, your dry eyes will be more severe. And also when we work in computer, when we work the computer, I think many times the environment is also air conditioned, and this also makes dry eyes worse. You see. Okay, how do we reduce this so-called computer vision syndrome? Okay, well, of course, ideally is we should not spend so much time in front of the computer, but many times this cannot be avoided. So if you have to use the computer for a prolonged period of time, maybe you can remember something known as a 20-20-20 rule. So it's quite simple. It means that every 20 minutes of looking at the computer, you should look away at an object or at a distance of 20 feet away for a period of 20 seconds. Okay, this will allow our accommodative muscles or rather our focusing muscles will allow some time for it to relax so that it's not always like under tension. So this will like decrease your tiredness of the muscles because you're allowing the time for your focusing muscles to relax. So remember the 20-20-20 rule. Okay. The other thing is, as I mentioned, when you work at the computer concentrating, so you blink less often. Well, if you can remember, then I suppose you can consciously blink your eyes more regularly, you see. Or I think a better option would probably be to use lubricant eye drops. There are many types of eye drops which are what you call artificial tears. So this helps to lubricate the eyes, and they are usually very safe to use even for long-term use. Okay? Because they don't contain any harmful chemicals. They are formulated to be more or less like our own natural tears. Okay, regarding the computer screen itself or the monitor, it is recommended to be positioned at least like 20 to 40 inches away. 20 or 40 or in between is actually you have to probably can adjust yourself and see what you think is more comfortable for you. But the important thing here is I think if you are looking at the monitor as a general guide, the top of the monitor should be at the level of your eyes. Okay, so that when you are looking at the screen itself, your head is actually tilted down a bit, so that you're looking down about 15 degrees. So automatically, if your top of the computer screen is at the level of the eyes, when you look at computer, automatically you should be looking down at about 15-degree angle. Okay, and this has been shown to be somewhat most comfortable position to actually look at the computer. And then yes, computer glasses also. Computer glasses which aid in focusing at a particular distance. As I mentioned just now, sometimes when you have refractive errors or when you press myopia, that means weakness for focusing in near objects, then you need to wear the proper glasses, which can help you focusing at that particular distance of the computer. Okay, and many of these computer glasses, they also have anti-reflective coatings, so they can cut down the glare as well as the stray light coming off the computer screen. Because glare and all these reflections, they will also contribute to eye fatigue as well, because they also cause overwork of your focusing muscles. Okay, so that is my part on the computer vision syndrome. Now we are going to talk about something which is also very common, probably more common than computer vision syndrome. Right? So what I'm going to talk about now is actually myopia. Myopia is actually the medical term for what laymen usually call as short-sightedness. Short-sightedness. The word short-sightedness means that your eye can only see short distance in front of you. Far objects or distance is blurred. So that's why this condition is called short-sightedness. People with short-sightedness, they can only see a short distance in front of their eyes. Distance vision is blurred unless they correct, for example, wearing glasses. So myopia or short-sightedness is actually the most common eye condition worldwide. Okay? And usually it's not considered a disease, but rather a refractive error. Refractive error means that it's more of a focusing problem. If you wear the correct glasses or contact lens or some way to correct the refraction, then you can see clearly. So people with myopia, basically, when they wear glasses or contact lenses, they can see very well. So it's usually not considered a disease, but rather a condition, a refractive error. Okay, just a bit of history on this myopia or epidemiology actually. So in according to studies in 2010, an estimated 27% of world population were found to be myopic or short-sighted. And it's actually expected or projected to increase to 52% by 2050. That means by 2050, it's expected that a bit more than half of the world will actually be short-sighted. Okay, and about 1 to 3% of these short-sighted people, they will have a condition called pathological myopia. Pathological myopia is that this condition of being short-sighted actually starts to cause actual disease of the eye. Okay? So these people with pathological myopia, they will be at risk of developing loss of vision, which is not correctable with spectacles. That's why I mentioned if you have ordinary short-sightedness, when you wear glasses, you should be able to see perfectly. But people who, because of the short-sightedness, have developed certain diseases of the eye, they will have loss of vision, which will not be correctable even if they wear glasses. And this pathological myopia, usually this happens in people who are highly myopic. Highly myopic means that the so-called power is very high, probably like at least more than 600 degrees or 6 diopters. So this is just a recapitulation. So in 2010, 28% is affected by short-sightedness in the world. By another 40 years' time, 30-40 years' time, half the world will be affected by short-sightedness. Okay, again, what is myopia actually? So we know it's short-sightedness. So the medical definition is actually, it means that the spectacle power is actually minus 0.5 diopters of clear. Or if you go to spectacle shop, commonly they'll say 50 degrees, short-sighted 50 degrees. Now, just like I mentioned, high myopia. High myopia is actually if the power is higher than 5 or 600 degrees, or medically minus 5 or minus 6 diopters here, higher. Now, what is the importance of differentiating this high myopia? People who are highly myopic, they have a higher risk of developing certain blinding conditions or eye diseases. Diseases means that you can actually develop a condition which causes you loss of vision, which will not be corrected with glasses. And these people in this group of high myopic, they are at particular risk. Okay, this one is just a bit on the what actually is the mechanism in this short-sightedness. So this one is this is actually just a rough diagram of the eyeball. This part here is the front of the eye. with the lens here, where my laser pointer is. And at the back of the eye, there's this layer of a nerve, what we call the retina. Okay, so in a normal eye, when light comes from the outside, the light rays will get focused exactly to a pinpoint on the retina. So a person with a normal eye, that means no short-sightedness, without glasses, they will see perfectly clear, because any light that enters the eye will be focused exactly on the retina, on the nerve layer here. In a nearsighted or a short-sighted or a myopic person, the light that enters the eye will not focus on the retina, but rather at a point in front of the retina. So that means the image on the retina itself will be blurred unless you wear glasses. Another condition I would just touch briefly is called for far-sightedness, which is probably I would say is actually the opposite of short-sightedness. In far-sighted people, the light rays which enter the eye, they get focused actually too far behind it, in fact to a virtual point behind the retina. So the result is actually the same. They will also see a very blurred image. Okay, so how do you actually correct this vision? I'm sure those people with short-sightedness, they know that when they put on their glasses, they have very good vision, or they put on their glasses or the contact lenses. Okay, that's because in myopia, as I mentioned, the light rays, they get focused at a point in front of the retina rather than on the retina. So the correction is actually you need to wear concave lenses. Concave means, I think if you remember your Form 5 physics or optics problem, you can remember that there are two types of lenses, concave as well as convex lenses. So if you want to push this focus of light further back to focus on the retina, you need to actually use concave lenses. Concave lenses, when light passes through concave lenses, the what you call the light rays, they will get diverge a bit, no? So they will open up a bit so that they can be focused further back and fall exactly on the retina. So this will correct your vision for myopic or short-sighted people. Okay. Contact lenses work in the same way basically. The shape is also concave, just that instead of glasses, you wear contact lenses. Okay, what causes myopia actually? Well, actually, it's multifactorial. There are actually several possible causes. Hereditary or genetic, this is believed to play a role. They have found that there is a higher incidence of myopia or short-sightedness if one or both parents are having short-sightedness. Okay. The other important factor which we have found through actually studies, observation is that during childhood, during childhood, if you have excessive or increased use of your near vision, during childhood, so this will result in a higher incidence of myopia, higher likelihood of having myopia. Studies have shown that the incidence of short-sightedness is actually lower in these European Caucasian children, where their schooling is such that they require less near work, as compared to higher rates of short-sightedness in East Asian children, where their system of schooling is that they need to spend more hours in near work. So it's believed that excessive use of the eyes for near work during childhood is a significant contributory factor to this development of short-sightedness. Okay, sometimes adults, they may develop late onset myopia, but this is usually due to cataract formation. Sometimes when our eyes have developed cataract, certain types of cataract, they can actually increase the myopia. And also incidentally, actually cataracts tend to develop earlier in people who are short-sighted, especially those who are on the higher end of the short-sightedness. Okay, what are problems caused by myopia? Well, obviously the most obvious symptom is blurring of distant vision. As I mentioned just now, people who are short-sighted, basically they can only see near objects in front of their eyes. Okay, but when they need to look far, it's blurred. Okay, so usually they need glasses or contact lens to correct their distant vision. Or alternatively, another method is of course if you want to reduce your dependency on glasses or contact lens, then another alternative is actually what I call refractive surgery. Having surgery to correct the short-sightedness. Okay, myopia or short-sightedness actually is also associated with a higher chance of developing what you call retinal detachment. Retinal detachment is where that layer of nerve at the back part of the eye, it detaches from the wall of the eye, as in that diagram I showed you earlier. So generally, people who are short-sightedness, who are highly short-sighted, they are at higher risk of getting this retinal detachment. Probably some reasons include in a highly myopic or highly short-sighted person, the retinal layer may be thinner because usually short-sighted people, the eyeball itself is stretched or longer, so the retinal layer tends to be stretched and is thinner than general. Okay? The other thing is that the vitreous jelly in myopic patients, they are not as firm, they are more so-called like a liquid, so the support they offer to the retina may be less. Okay? So anyway, the main thing is that retinal detachment generally they have higher rates in myopic or high myopic people. Okay, so myopia itself, short-sightedness itself, is also found to be linked to a higher incidence of glaucoma, okay, as well as earlier onset of cataract development, which I mentioned just now. Glaucoma actually briefly is a condition of the eye where the eye pressure is found to be higher than normal. And if this is not treated over time, this high pressure actually causes progressive and permanent damage to the optic nerve of the eye. Optic nerve is actually the nerve of the eye which subserves your vision. And high myopes, they are also at risk for developing certain diseases. This group of diseases basically they cause abnormal blood vessels to grow in the retina. So in this condition, it's called choroidal neovascularization. And means there's growth of abnormal blood vessels in the retina. So this obviously will cause blindness if untreated. If untreated, all these abnormal blood vessels, they will cause like things like bleeding or swelling of the retina, all of which leads to visual loss and permanent damage if not treated. So this is just a photo showing you a retinal detachment. Retinal detachment usually starts when there is a tear in the retina. See here you can see this U-shaped area here. This is actually a retinal tear. So once a retinal tear happens, the internal fluid of the eye enters this tear or this hole, and the fluid goes behind the retina, and the whole retinal layer or part of the retinal layer will sort of like float off. Will get detached from the wall of the eye and float off. So this will cause vision loss, and this condition needs urgent surgical treatment. Delay in treatment may affect the prognosis. Okay, that means if you delay this kind of surgery too long, the results may not be too good. If the retina remains detached for a longer period of time, the surgical result may not be so, the visual result may not be so good even after surgery. The other condition here is what I mentioned just now, the choroidal neovascularization. So in this condition, which affects especially people with high short-sightedness, there will be abnormal growth of blood vessels in the eye. So this will cause things like bleeding. As you can see here, there's a bleeding here in the retina itself. And sometimes if it doesn't bleed, it may cause a protein leakage from those blood vessels, which also causes blurring of vision. So this condition obviously requires urgent treatment. If treatment is delayed, then the bleeding, the swelling all may cause permanent retinal damage. So much so that if you treat the condition today, you may not be able to preserve good vision or restore good vision in the eye. Okay, for myopic or short-sighted people, I think there are a few points you have to remember. If you have short-sightedness, it's not just, you should not only just visit your optometrist or optician for glasses checking, but I think you should also find the time to see an ophthalmologist just for a routine examination to screen for those conditions that I mentioned just now, things like glaucoma, short-sightedness, things which may lead to retinal detachment. So all these things there's a higher risk of it happening in people with myopia. So I think you should also make time for just a routine or regular examination with an ophthalmologist or eye specialist. Basically, optometrists or opticians, they can only check the tower of the eye glasses. Basically, they cannot check your eye structure, and the what do you call it, your retina. So getting a specialist eye examination is important, very important. If your vision is still blurred in spite of wearing glasses or contacts, that means if you are myopic, short-sighted, you make new glasses or you wear your visual contact lens and you find that the vision is still blurred. So this means that there is something wrong with the eye. Okay, it's not just short-sightedness. There's some other disorder going on. So this may signify presence of eye conditions which may need urgent treatment to prevent blindness. Okay, so whenever you think that your eye is more blurred than usual, especially if you put on your usual glasses, you don't see well still, then I think you have to go and see an eye specialist. Okay? Certain conditions you will need urgent treatment. Certain conditions if it's seen too late, then the prognosis or the visual result may not be so good. Another symptom which I think myopic people, short-sighted people, or actually anybody actually, they should take note of is seeing what you call floaters. Floaters, they are like sort of like semi-transparent, maybe dark shadows or dark objects floating in a field of vision. Okay? Or flashes of light, something what they call flashes of light. Sometimes in some people they may perceive that in the eye there's some camera flash or lightning going on. Okay? Or sometimes more serious, some people may start to see a dark shadow or a curtain in one corner of your field of vision or one part of your field of vision, maybe up or down, maybe from the side. Okay, if you do see this kind of dark shadow from the side coming on, this is actually a very suspicious sign of a retinal detachment, which I mentioned just now, and you need urgent consultation, okay, which is very important to avoid permanent blindness. So take note of this. Seeing floaters or flashes of light, this is actually an important symptom which you should seek specialist examination as soon as possible. Okay, because it may signify something very serious. Okay, so I've completed the first two parts, computer vision syndrome and short-sightedness. So I would just like to take the opportunity to just ask you all if you have any questions at this stage, you may feel free to ask.
Yeah, so we just have a quick intermediate Q&A session. So we have one question from Wai-Ting, Dr. Lim. He's asking, what is the difference between floaters and computer vision syndrome?
Well, floaters and computer vision syndrome, actually these are two entirely separate conditions. In computer vision syndrome, it usually doesn't cause you to see floaters. Floaters actually is the perception or what you're seeing actually like a small dark objects, or sometimes it may look like transparent or semi-transparent. They may look like worms, they may look like mosquitoes. Sometimes they may appear as a cloud. So all these things, they are like what you call floaters because they actually like float around in our field of vision, and usually they will follow your direction of this. When you look to the right, you find that shadow or that object also like sort of moves to the right as well. When you look back in front, it sort of like also clicks back to the center. So it's actually floaters actually is something that you can see, those objects that you can see in your field of vision. So it's actually not related to computer vision syndrome. Computer vision syndrome, you per se does not cause floaters. What you get is actually those symptoms I mentioned just now, like tiredness or the dry eyes, and the eye fatigue, that kind of thing. I hope you understand what I just said.
Any more questions? Quick one before Dr. Lim proceed with the second half. If you have any question, you can unmute yourself. You can unmute yourself to ask a question. You can have direct interactions with Dr. Lim. Anyway, just want to welcome, there are some attendees that actually came in. Want to welcome Chiayi, Janice, KS, Julie, Something, and Yusiu. So don't worry, those who actually came in late, we still got a second half. So any more questions from the rest? If no, then Dr. Lim can actually proceed with the second part of his presentation. Okay, if no, then we will proceed with the second part. But before that, for those who want more updates about our webinar, a future webinar, because we're going to have a next webinar by Dr. Umi Kausam, the silent blinding diseases. So maybe for those who have not liked our FB page, please like our FB page. We will paste our FB page link into the chat. So you can please like our page for more updates, future updates of our next webinar session. So if there's no more question from everyone at this point of time, then Dr. Lim, please proceed with your second part. Thank you.
Okay, sure. Okay, so my last and final part here is actually laser eye surgery, which I very briefly mentioned just now. So laser eye surgery is actually the medical word actually is a photorefractive surgery. So it's actually an alternative option. It's an alternative method to correct refractive errors, apart from the usual method of using glasses or contact lenses. Okay? So this is actually involving the use of surgery to correct refractive errors. So refractive errors, as I mentioned just now, is actually myopia or short-sightedness, another condition called hyperopia, and then there's also a condition called astigmatism. Astigmatism is also a form of refractive error. Same thing, the same result. They will also need glasses to see clearly. Okay, here is a diagrammatic representation of refractive errors. Okay, so this one here is a normal vision, an eye with normal vision, which I also touched on just now. In the eye with normal vision, light rays that enter the eye, they get focused exactly on the retina here. So people with normal vision, obviously they see clearly without glasses. People with short-sightedness or myopia, light rays, they get focused not on the retina, but rather at a point in front of the retina. That's why they need glasses or contact lenses. In hyperopia, the light rays get focused too far behind the retina, in fact. Okay? Now, astigmatism actually is a condition where light rays that enter the eye, they get focused not on one point in the eye, but rather at two or more different points in the eye. Okay, so the result is actually the same. You will have blurring of vision as well, and also will need refractive correction in the form of glasses or maybe a special type of contact lens. Right? Okay, LASIK. LASIK is actually our most commonly used photorefractive surgery method to correct this refractive error, especially myopia or short-sightedness. Okay? So why LASIK? Okay, one of the reasons or indication is cosmesis, meaning that some people, they feel that they look better without glasses, so they will want this option to actually not need to wear glasses. In some other people, they will they are what you call, the reason maybe they want more freedom from glasses so that they can take part in various sporting activities or leisure activities like swimming, contact sports, no? Because in these conditions, wearing glasses would be not very convenient. No? And then certain occupations, of course, occupation or career, for example, police, military, airplane pilot, they may require good glasses-free vision. Okay? Sometimes it's just that it's more cost-effective in the long run compared to contact lenses or glasses. Contact lenses or even glasses, they are not exactly cheap actually. So you can eliminate the need for these contact lenses or glasses in the long run. You can actually probably, it's more cost effective. You can save more money. And safety is an issue. Sometimes if you have sometimes if you are in an emergency condition and you don't have access to your glasses, or you need to actually look for a glasses and all that, so a safety issue may actually be one of the reasons why you can get LASIK for it. Okay, now LASIK is actually it's something which is actually not for everybody. It's suitable for a lot of people, but you need to be actually screened to make sure that you are suitable for LASIK before you actually even before you go for it, you have to be assessed for the suitability basically. So the criteria is you must be at least 18 years of age, and not only that, but your refraction or your so-called your power, your eye power, should be stable for at least 1 year. If your power, for example, if your short-sightedness is still not stable, every year it is still increasing, then I think there's no point to do LASIK at that time. You see, but if you were to correct your short-sightedness at that time, if it's still not stable, a year later or 1 or 2 years later, you will start to become short-sighted again, because your power is still not stable, it's still increasing. So your power should be at least stable for a year. And then you should have reasonable visual expectations. Well, of course, everyone who does LASIK, of course, they expect good vision, and yes, I would say most of the time, or many times, you will definitely have good vision. Okay, but there is also you must have a reasonable visual expectation. LASIK, the main purpose I would say is to enable you to have a vision which is good enough, definitely good enough to do all your usual daily activities. Things that you do every day, like driving, watching the TV, uh, reading, all those things you do daily, you expect to be able to do all those after LASIK without the use of glasses. Sometimes certain patients, they may have very, 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 what you call high visual expectations. They may expect like what so-called perfect vision, that means like maybe from a distance of 100 meters, they will think that they can see a very small object, like maybe a fly in the wall. Well, I'm not saying that's not possible, but sometimes that it may not be possible to have that such high level of crystal clear vision. But sometimes after LASIK, there will be a bit of so-called power leftover, but usually the leftover power is actually very, very, very low, and your vision is normal or very near normal. Whatever it is, you definitely will have no problem doing your usual daily activities without any problems, without wearing glasses. And then the other thing is the eye itself should have no eye diseases like corneal dystrophies, cataract, glaucoma, infections like ocular herpes virus infections, or retinal diseases. So obviously all these things, if you do LASIK surgery on an eye with all these diseases, obviously the visual result will not be satisfactory even after you have done the LASIK. An important point here is during the assessment for suitability for LASIK, we have to do a corneal scan, mainly especially to measure the thickness of the cornea. Cornea is the front part of the eye, the membrane, the transparent membrane in front of the eye. We need to assess the corneal thickness to make sure that it is thick enough. If your power is high and the cornea is not thick enough, then LASIK may not be that suitable for you. You have to go for other options instead. And then in general, the person should be healthy with no diabetes, autoimmune diseases, or immunocompromised, because all these things may affect the healing. And then lastly, the candidate should not be pregnant or shouldn't be breastfeeding, because during these conditions like pregnancy or breastfeeding, your the level of hormones in the body may not be exactly like very normal. So this may actually affect the refractive state of the eye. That means the power eye during this period of pregnancy or breastfeeding may not be actually very accurate. So we don't recommend you to do LASIK during this period. Okay, one of the things we actually do when we assess your suitability for LASIK is something called the oculizer examination or the corneal topography. It means our machines will need to assess your cornea. Cornea is the front membrane of the eye. Okay, so this one is an example of a scan here. And this example of the scan actually shows that this candidate or this person is probably not suitable for LASIK, because the cornea has an area of thinning here, and this part of the cornea is a bit thinner than normal. So these type of conditions, we don't advise to go for LASIK, because if you were to do LASIK on the patient like this, after the LASIK procedure, this area of the cornea may suffer progressive and worse thinning, okay? And this will lead to issues which will cause, of course, deterioration of vision, which will not be correctable. Even if you put glasses or what, it will not be correctable. You see, this condition may even need surgical intervention. So basically, not everyone is suitable for LASIK. Sometimes you do get this sort of condition, which luckily is able to be picked up by our machine. So we can tell this patient straight away that they are not suitable for LASIK. So if you have to do LASIK on this patient, we can expect them to have a lot of post-operative problems. Laser eye surgery, or what is the sort of laser eye surgery available? Basically, we have two types here. One is called the wavefront optimized bladeless LASIK, commonly what we call bladeless LASIK. This procedure is actually, there is a flap. Later I will elaborate a bit more on why there's a flap there. And the other alternative laser eye surgery is what we call ASA, or advanced surface ablation. In this condition, the procedure is done without a flap. Basically, this second procedure here is only carried out if the patient is found to be not suitable for the first one, the bedless LASIK with flap. So if the patient is not suitable for this one, the reason probably being either the cornea is too thin or the tower is so-called too high, then we need to go for this second procedure instead. This advanced surface ablation without flap. Okay, this one is a diagrammatic representation of the LASIK procedure. Here I'm just showing you the method with the flap. Okay, so this is this front part of the eye. What if you look at the mirror, you can see the dark or the black part of the eye. Okay, it's actually not black or not brown, but it's actually a transparent membrane. We see as dark is because underlying just behind the cornea is your iris, and iris in Asians like us is either it's dark color, not chocolate color. But the membrane in front of the cornea is actually a transparent membrane. So LASIK procedure actually involves surgery on the cornea, laser surgery on the cornea. So okay, what happens in the first step is that the femtosecond laser, femtosecond laser is one of the lasers we use for the LASIK procedure. This femtosecond laser, which is actually computer controlled, it will cut a very thin superficial layer of corneal flap like this, and the whole layer is not cut through and through, but a thin shear is left here, so that when the flap is cut, it then flips over to the side like this here. Okay. Now once you have cut the flap and the flap has been flip over to the side here, then you can use the second type of laser, what we call the excimer laser. The excimer laser is now focused on the bed of the cornea, that means this area where the flap is visible. So this excimer laser will actually reshape, if you like what we call remove part of the corneal tissue to reshape it to correct your refractive error, your sight centeredness or whatever. So once the excimer laser has done its job, completed already, then this flap here is again repositioned. The flap is then flip over again to cover up the raw area which has just had the excimer laser done. So the flap covering over this raw area of excimer laser, this actually helps the eye, the healing, to be very pain-free and also very fast. And because the operated area or the laser area usually is protected again by the flap. Okay, so the patient usually after the flap procedure is very comfortable because there's a flap protecting the raw operated area of the eye. Okay, basic laser. So basically this is our wave-like refractive suite which I mentioned earlier on. So this set of instruments or machines here is what allows us to perform our LASIK surgery. So the one that we are using in our center is the wave-like refractive suite. So this is actually a very truly integrated system. Okay, that means all the different components of this system, they are actually linked together so that all information can be transferred seamlessly between all the machines without the need for human, the human factor as in like retyping the data or re-entering the data. So this virtually eliminates all a lot of human error factor there. So this is a very fast, ultra fast platform. It combines a 500 Hz excimer laser and a 200 kilohertz femtosecond laser. Basically, in this LASIK unit, there are two types of laser: the excimer laser, which performs the so-called power correction, and the femtosecond laser, which cuts the flap, which I mentioned earlier on. Okay. Again, there's as I mentioned earlier, there's seamless data transfer within the wavenet. And this machine, as you notice, it actually takes up quite a small amount of space. It easily just takes up maybe like 1/3 or half the room. Okay. And there is a swivel bed, that means a bed which is mobile, which can control the weight, can be swung to the left, to the right, okay, so that the patient will not need to get up from the bed and walk to a different machine. Okay, so the patient can just lie down very comfortably, and the bed will shift the patient position to the required machine. Okay, so the patient will have enhanced patient comfort. So this is, as I mentioned, it's a very safe machine. It's integrated. The diagnostic machines with all the data is actually seamlessly transferred to the actual laser machine itself. So all this is transferred without the need for humans to people to retype the data and everything. And then the eye tracking on this machine is very fast. Okay, it's like 2 milliseconds eye tracking means that during the laser procedure or at every stage of laser procedure, basically the machine is tracking your eye. Make sure that your eye is always in that certain suitable position for the laser to work on it. If at any time the machine is finds that your eye is starting to like run to the side a bit or look away, immediately within 2 milliseconds, the laser will be shut off, will be stopped temporarily. Okay, so they see this makes it very safe. There's no question of so-called like miss shooting or whatever. And this machine is very fast. The speed itself is also a significant safety factor there. Okay? When the machine is very fast, it's of course more precise and very predictable, and it's less uncomfortable for the patient because the less time you spend under the machine, of course, the patient will be more comfortable. If the patient will spend a long time on the machine, they will start to get anxious, fidgety, and move around. So the machine is very fast. As mentioned just now, the femtosecond to create a flap probably takes less than 10 seconds. And for most so-called average eye power, I think the time under the excimer laser itself is also many times it's less than 10 seconds itself. So the whole laser time itself is probably like less than 20 seconds. And one part of this procedure is that before we use the femtosecond to create a flap, actually we need to apply something like a suction cup on the eye. So with this particular machine, the suction that we employ is actually not too high. Okay, so this is definitely more comfortable for the patient. Okay, this machine, of course, is very versatile. It can correct a wide range of refractive errors, short-sightedness, astigmatism, even high degree. Okay, and yes, presbyopia also in certain candidates it can also be done. So it can also correct presbyopia. And previous so-called failed laser or cataract surgery, sometimes previous surgery they may leave behind residual power. I mean, after the first laser surgery, then we still left behind power so that the patient cannot see very well. Or sometimes after cataract surgery, some patients, when they have cataract surgery, they implant multifocal lenses or lenses that will at least correct their distance vision. So sometimes after cataract surgery, the power left behind may still be a bit high, so much so that the patient, if he does not make glasses, he still can see clearly. So in those cases, you can actually also use this LASIK or this LASIK method to actually correct whatever residual power left behind from previous laser or cataract surgery. Okay, here I'm just going to show a video just to show the what do you call it, a fast video on an actual LASIK procedure going on. This one, just give me a second to adjust this. Okay. Okay. So actually, this video is actually Dr. Lee performing this LASIK procedure on a patient here. Okay, so doctor will look through a microscope, which is part of the machine, and then this is actually the stage where they place the suction cup on the eye, which I mentioned. This is done before you create the flap. So this suction cup, it will what they call latch on and suction and hold the eye stable. And then this shows the femtosecond laser creating the flap. So you can see the procedure itself is so fast, it's very much less than 10 seconds, it's already completed. The flap has already been created. Okay. So once the flap has been created, then the suction cup is released from the eye. Okay. Now the patient is ready for the next stage of the surgery. So now the patient is moved to the other machine, the excimer laser machine. So the flap which was created just now, as I mentioned, is flipped to the side now. Okay. So the doctor has now flipped the flap to the side, and this is actually the exposed area of cornea where the second type of laser, the excimer laser, will now work on this part of the cornea bit is called. So now the procedure by the excimer laser is completed, and the flap is again repositioned with the eye. So the procedure is actually now completed already. Okay, so the laser has been done, the flap has been positioned already. So you can see it's actually very fast. Okay, now as with any kind of procedure, of course, there will be possible side effects. I'm sure many of you also have heard that LASIK. Probably some people will say, "Oh, LASIK has got a lot of side effects." And all that. Okay, well, actually, in general nowadays, side effects or complications all have very much reduced compared to the older days. Older days, because of technology and the method also is a bit different. Of course, complication rate, side effects were a bit higher, but nowadays it's actually very low. So here I will elaborate a bit more in detail on what are the possible side effects you can expect. Okay, most commonly I would say would be dry eyes. Now the dry eyes after the LASIK is usually not severe, unless you have pre-existing severe dry eyes. If before the surgery you have very dry eyes, then after surgery you may expect to have a bit more dry eyes. But I always feel that this dry eyes after surgery is also sort of compensated for by the fact that you no longer need to wear contact lenses. Before LASIK surgery, many patients, or I would say like a huge proportion of the patients, they need to wear contact lenses to correct their short-sightedness. So the contact lenses itself can cause very bad dry eyes sometimes. So after you're done LASIK, you can throw away your contact lenses. So that itself actually relieves a big part of your eye dryness. So anyway, the incidence of this dry eyes actually is not high. It's just around 20%, and usually this is very simple to handle. You just need to use regular use of your artificial tears or lubricants, and usually after maybe half a year, the condition, the dryness, it will improve a lot. Okay, the other possible side effect is glare or starburst. Okay, at night time when you're driving, maybe you may experience a bit more glare, or maybe you may see a starburst of light. When you look at the oncoming light and all that. Okay, incidence of this again is not high. It's like 3%, and again this also improves over time, probably like over the next few months or half a year. Sometimes all these glare or starburst, they may actually be due to dry eyes itself, so you need to be more regular with your lubricant use. Okay, post-LASIK corneal aphasia, sometimes very low incidence, maybe around like 0.05% of cases, sorry. Okay, there's a very low incidence of corneal aphasia after LASIK thinning. This is a very low incidence, 0.05%. And usually this doesn't happen to everybody. It happens in maybe predisposed individuals with like young age, or those who have like thin cornea, or very thin residual corneal vein left behind, or high myopia patients, or those with a very mild form of sort of a type of corneal disease we call keratoconus. Basically, like thin corneas or this form plus keratoconus, that means these abnormal corneal patients usually we would have excluded in our pre-LASIK screening. That's why the pre-LASIK screening is very important, especially your oculitis scan. But this efforts to eliminate patients who are not suitable for LASIK. So the other possible side effect of LASIK is actually your corneal infection, infective keratitis. As with any surgical procedure, infection is always a possible complication. Now, with LASIK itself, actually the incidence of infection is actually very low. 0.1 to 0.01, sorry, to 0.02%. And actually, the risk of corneal infection is actually even higher if you use contact lens for a long time. Actually, and actually, all these incidents of side effects is actually markedly reduced with careful screening and exclusion of unsuitable candidates. That's why, as I said, LASIK is not for everybody. It is suitable for a very large proportion of people, but there are some people who are not suitable. So it's very important that before LASIK, we actually pick out that small group of people and advise them not to have LASIK. So if we screen a patient properly, it's actually a very safe procedure. Okay, just to share you a bit on this is actually based on the study, the trial study, or what they call patient-reported outcomes in LASIK. It's actually a study which involves about close to 600 patients after who have had LASIK done in 2017. The study was done in 2017. So in general, the outcome is that 20% of patients, they report dry eye symptoms for about 6 months, as I mentioned just now. 3% they experience, as I mentioned just now, a bit of glare, starburst, or maybe a bit of halos and the light. 99% of patients, they had 6/6 vision or even better. And when you ask the patients, 98% actually said that they were satisfied with the result of the surgery. So the trial study, the outcome is actually, you can see here, is actually quite reassuring. Okay, so with this, I bring my talk this evening to an end. So as usual, if you have any questions, please feel free to ask.
Okay, thank you, Dr. Lim. Very informative. Is this your last slide, Dr. Lim?
Yes, this is my last slide here.
Okay, just make sure it's done. All right. Okay, so we have one question from KS. Hi, Dr. Lim.
Hi,
Does
hello.
myopia affects the amount of floaters? Higher the power, the more floaters?
Yes, in general, I would say the higher the power, the earlier onset, the earlier you will at an earlier age, you will start to have floaters, as well as the amount of floaters probably may be a bit more. Floaters are actually areas of liquefaction or degeneration in the vitreous jelly of the eye. So in a myopia patient, myopic patient, the vitreous jelly is a bit it's a bit less firm. That means the hyaluronic need to be scientific a bit. The hyaluronic acid content in it is actually probably like less than 50% of normal people. So the vitreous jelly itself is actually less firm. It's more so-called liquid. So as such, all these degenerative processes like liquefaction, they tend to happen more to a greater degree as well as at an earlier age in this myopic. So yes, in myopic patients, yes, they tend to have earlier onset of floaters, and the floaters may also be more than as compared to a normal person without myopia.
So Dr. Lim, which means for those people who have higher short sight power, in fact, they should have more regular checkups, right?
I would say definitely so, because with higher power patients, as I mentioned just now, they are especially at risk for conditions like retinal detachment, because their retina tends to be thinner than normal people. Also, this vitreous degeneration, that means that vitreous jelly, the degeneration and the shrinkage of it happens earlier on. So the shrinkage and the degeneration is what they call cause pulling traction on the retina. So this may lead to retinal tears and subsequently retinal detachment. So that's why I mentioned important symptoms to look for is those like floaters. Floaters and flashes, you should definitely see an ophthalmologist at your earliest convenience.
Okay, which means, Dr. Lim, in this case, in what kind of range of short sight power is considered high, is deemed high?
Okay, generally, as I mentioned just now, more than 500 or 600 degrees is considered high, and they will definitely be at higher risk for things like retinal detachment or those pathological myopia conditions such as choroidal neovascularization, where there's growth of abnormal blood vessels or bleeding in the eye. But then, even then, like things like retinal detachment have also been known to happen in people who are moderately myopic. Don't have to be very highly myopic. Sometimes even moderate myopes, like maybe like around like 300 to 500 degrees or so, they also have increased incidence of this retinal detachment. And in these myopic people, like moderate to high myopes, in certain areas of the retina, they may have what we call predisposing lesions. That means in these myopic people, certain parts of retina may be so-called more thin than usual. So much so that these thin areas, they are prone to developing holes or tears. So yes, if you are myopic to any extent, I would say that you should get a routine eye examination, irrespective of whether your power, whether you have any problems with your vision or not. I think you should get a routine examination.
Sorry, Dr. Lim.
Yeah, sorry, I couldn't hear.
Sorry. Okay. I was just wondering, like for those people who have high short sight power, and they do have floaters. Would they be a suitable candidate for LASIK?
Okay, LASIK suitability of LASIK actually doesn't have anything to do with whether you have floaters or not. But the important thing is that whatever it is, if you are planned for LASIK, you should get a detailed eye examination. So the detailed eye examination will tell us whether there are any problems if you were to do LASIK. Okay? Floaters itself is not a contraindication for LASIK. Such.
Okay. All right. Thank you, KS, for your question. Okay, the next question will be from Chia Yi. Hi, Dr. Lim. Is there any restriction or do's and don'ts after LASIK?
Okay. Okay. Generally after LASIK, of course, one of the important things is you should not rub your eyes, because LASIK the most common procedure done with LASIK is that there is a flap there. So the flap, as you know, we don't use any stitches to hold it down. We just flip it over and just let it like adhere to the eye. So you will need the time of at least a month for a reasonable amount of healing to occur. So in the meantime, if you were to like rub the eyes hard, there's a risk of dislocating the flap. And also we advise no contact sports, like things like maybe like football or karate, taekwondo, that kind of thing, where there's a risk of direct trauma to the eye. And also in the first 1 month, of course, we also don't advise you to go for swimming, okay? Because before the flap is adequately healed, there will be risk of bacteria migrating under the flap and causing infection. Basically, it's just avoid contact sports, no rubbing, no swimming in the first 1 month after the LASIK.
I mean, for Asians, after LASIK procedure, is there any like pantang in terms of food wise that we cannot eat?
Okay, Asians, yes, as you know, Asians, they have a lot of pantang in terms of food after any procedure, not only LASIK. Well, in general, in my opinion, I don't think there's any, I don't think there should be any restriction in terms of food. I mean, this is like, I think the most important thing is that you should be regular with the eye drop to help in healing, reduction of inflammation, and of course to prevent infection. Food as such, I don't advocate any kind of restriction actually.
What about, just now you mentioned there's an age 18 and above, right? That will be suitable for LASIK. What about maximum age that can proceed with LASIK? Is there a maximum age?
Well, good question. It's a lot of part of the decision whether to do LASIK. Actually, also you have to discuss with the patient. For us doctors, if there are some clear-cut in contraindications, things such as if the patient is of the age where there's already a possibility of cataract in the eye, and on examination we do find that there is cataract or at least early signs of cataract, then of course we don't advise the patient to go for it, because cataract is a progressive condition. So if you were to go for this LASIK procedure, then as your cataract progresses, of course your vision will be blurred again, and you will need another procedure in terms of cataract surgery to actually correct it. And then the other thing is that the patient will also, if they are at a presbyopic age group, that means they are at the age where they will require glasses or lens, then you have to let the patient know that even if they don't have a cataract at the moment and they are suitable for LASIK, then you will have to tell them that after LASIK they require glasses for reading, or they can undergo what we call this monovision LASIK. That means in one eye, the non-dominant eye, you can choose to leave it like a bit myopic to help with the near vision. But then again, like not everyone can tolerate this monovision. So before that, we have to assess patient that they can actually tolerate monovision. And LASIK itself also, yes, there is a program that it's possible that you can correct presbyopia as well. But honestly, the result is a bit variable. So in general, we don't usually advise the use of LASIK, at least in our practice, to correct presbyopia. So this basically is do these two things. At the age where you think there's cataract going on, then you really need to assess on that. And then patient needs to be very clear on the use of these presbyoptic glasses if the need is there.
Okay.
Okay.
Thank you. We have one candidate private message us. Her question is from Julie. She's asking how long does it take to recover after LASIK?
After LASIK, well, it's in general it's regarded as 1 month. So that's why we advise that in that 1 month, you should not go for swimming. You should avoid like contact sports and all that. So in general, it's regarded as 1 month period.
Okay. She has another second question also from Julie. If one of the parents have glaucoma, does their children will have higher chances of having glaucoma as well?
Yes, actually glaucoma has been shown to have a genetic predisposition. If your parent or one of the parents or your parents have got glaucoma, then yes, you do have a slightly higher risk compared to a normal population. And actually, it's been shown that if your siblings have your brother or sister, your siblings, if they have glaucoma, then your risk of having glaucoma is actually even a bit higher than your parents having glaucoma. So yes, there is a genetic factor here. Okay, by the way, I've just noticed there's a question here from Dato YC actually.
Yeah. Okay. What happened to those people with very high short-sightedness and are not suitable for LASIK and they want to be glasses free? Is there an implantable contact lens and does your center perform this procedure?
Okay, yes, this is a very good question. Yes, occasionally we do come across patients whom the so-called power is actually very high and beyond the range of LASIK. So in such patients, yes, if they are suitable, there is implantable, what we call IPCL, implantable contact lens procedure. And yes, our center, we do perform this procedure, but of course, as with any procedure, the patient will need to have a pre-operative assessment to assess the eye properly to make sure that they are really suitable for this procedure.
Okay, but still need to be assessed, right?
Yes, of course.
The suitability. Okay, I'm just curious, Dr. Lim, for some people, I mean, especially for female patients, due to vanity because they want to be glasses free, right? But after when they are glasses free and due to vanity, are they, would they be suitable to put on color contact lenses after LASIK?
Okay, yes, I do have some patients who have been asking me this question. Well, actually, in general, after LASIK procedure, I don't usually advise them to use any kind of this color contact lenses. Mainly, is actually there is a slight risk of trauma to the flap area during the removal of your contact lens. Because when you create a flap there is no matter what, there is a flap at the edge of the flap there is actually what you call a residual kind of maybe a mark or something there. So sometimes if you are a bit rough and you remove contact lens and you sometimes your fingernail or what may actually may cause a bit of damage to that area, the flap edge area there. And in general, after LASIK, also eyes tend to be a bit dry. So if you were to use long hours of your this color contact, that also may worsen the dry eye condition. And a lot of these color contact lenses also, the what do you call, the manufacturer may be a bit dubious. Sometimes you can buy them online, also may not be actually very good for the eyes. So in general, yes, I would actually advise to use color contact lenses.
Okay, I'm just wondering, any more questions from the rest? Wai Ting, you have any question? Other participants, Janice, Chia Yi, any more questions? Dr. Lim, I have one more, since they are shy to ask. After LASIK procedure, will the power actually come back or not?
After LASIK procedure, well, if you have if like during the pre-op assessment, you have made sure that the refraction has been stable for at least a year or so, then I think the risk for actually what do you call it, coming back of the power, I think is very, very low. Very, very low.
Okay. But if let's say, example, if the power actually come back, it can still do a touch up, right?
Well, most of the time, if the power comes back, most of the time, I think it will be like a very low degree that it will not come back like a few hundred and all that. So many times, yes, you can actually do a re-LASIK, a touch-up procedure. But of course, that will depend on a few factors. Most important, of course, would be how much of corneal thickness is left behind after the first procedure. So if after the first procedure, let's say before the procedure, your power is not very high, like maybe just 200 or 300, so I would expect you have a lot of corneal thickness left. So if such a case, you have any what they call recurrence of the power, then I think touching up shouldn't be an issue. We are very highly short-sighted before that. We remove a lot of corneal thickness already. Then if there is a recurrence of the power, then if the cornea is too thin, then I think it may be an issue to touch up the case.
Okay, Wai Teng will say, I will go down from KL to your center to check through computer vision syndrome. Okay, Wai Teng, if you are keen, you can just call us to make an appointment for you. All right, to see Dr. Lim. Any more questions from the rest? No, I will ask one last famous question usually patient will ask. Will this LASIK procedure is it painful procedure or not?
Painful, actually, in general, I would say no. Rarely, even if patients, I don't think they've ever complained of pain. At the very most, it is a slight discomfort. Probably during placement of the suction on the eye, it may be a bit, I wouldn't say painful, probably uncomfortable, because that you will feel a bit of suction, so that maybe patient may not be used to such a sensation, so they may feel a bit uncomfortable. But then there's only in very small number of cases. In general, I think most of the cases, far and wide, they don't complain at all. They are quite comfortable during the procedure itself. Important thing is during the procedure, we explain to them every step that's going on. So this actually allays a lot of their anxiety.
Okay. So I guess no more question from the floor. So for those who have not liked our Facebook page, remember to click our link to like our Facebook page so that you will be updated on our next webinar. Our next webinar will be by Dr. Umi again, the blinding eye disease. Right. Yeah, the silent blinding disease, which is actually glaucoma. So just now we have one question regarding glaucoma. So if you like to understand a bit more, you can share with your friends as well that our next session will be about glaucoma. All right, it's a silent blinding disease, which is pretty scary, right, Dr. Lim?
Yeah.
Okay, for those, I think if you can, please turn on your camera. We can take a screenshot of this this webinar with Dr. Lim, and we also have Dr. Liman Wai in the house. We have Dr. Umi Kausam. So please turn on your camera and then we can take a screenshot. Come on. Ready? Cheese.
Thank you.
Okay, we got people coming in. One more shot. All right. Smile. Thank you, everyone.
Thank you, Dr. Lim. Wonderful lecture.
Thank you very much, Dato'. Good night, Dato'.
Yeah, very nice. Very nice.
Good night, everyone. See you next round.
Okay, good night, everyone. Bye.
Bye-bye.
Okay.